Many of my colleagues getting requests for things like horns or other interesting body modifications. I never have to be sad about going to work because I love what I do.
My name is Erica, and we are here in New Orleans at the ASPS Plastic Surgery 2025 meeting. Can you tell me your name and where you're from?
Yeah, I'm Steffen. I'm a plastic and reconstructive surgeon based out of Central Missouri.
Great. So tell me about your practice. How large is it? How many doctors do you have? What do you guys specialize in?
I'm part of a big multi-specialty group, over 50 doctors and a bunch of nurse practitioners as well, and I'm the only plastic surgeon there. So I do a community plastic surgery practice. Obviously, the focus of my practice is on, of course, aesthetic and cosmetic surgery, specifically eyelids, face, noses, as well as breast and body, like mommy makeovers, liposuction, tummy tucks, things like that. So that's really where my structure, my focus is. But I'm needed elsewhere in breast reconstruction, hand surgery, things like that.
Awesome. So you guys have multiple locations, multiple different specialties, and you guys are physician owned. So can you tell me a little bit about that?
Absolutely. So plastic surgeons, I think, are some of the last bastion of private medicine. So our group happens to be a little bit rare in that in terms of being an independent, large multi-specialty group. And that allows us to negotiate with insurance companies for good rates for our physicians to be fairly paid, and also we're able to take care of a wide variety of patients in our community. So we have a lot of people from the surrounding area who are really counting on us for care, and we deliver high quality care. But the location that we're at is essentially doctors who want to be in that area already are there, and so the level of care that we can deliver is really high, and very few things that we have to send out from our area for subspecialty care.
Awesome. And then you guys also have shareholders in the business, right?
Yes.
How does that work?
Yeah. So not all physicians in our group are shareholders, but everyone, it's, some of these things come down to finances, just like someone's personal finances at home would be. If you're a doctor in the group and you've been there a year or two and you're covering all of your expenses, as I am, your expenses for rent, nursing expenses, things like that. If you do all of that and your income exceeds that and you're able to pay yourself and all of your overhead, then you can become a shareholder and you're voted into the group and you go from there. So like I said, very similar in that respect to just how personal finances would work. Is a good comparison of how to think about it.
Okay, and you're a shareholder?
I am, yeah.
Okay, great. And how long have you been a shareholder?
I was shareholder about 6 months, which meant that I got busy very quickly when I was there, and that was a good thing, and I'm very grateful to my partners who helped me do that.
Wow. So what about your personal history? What led you to get into medicine?
It's something that I wanted to do since I was very little. Maybe for a minute I wanted to be a veterinarian, which I don't know, that's kind of a dorky answer, but that might be what I would do if I weren't in medicine for people. But I wanted to do that since I was little. And then after college, I got into med school, and that was just like the biggest thing, biggest day of your life up to that point. And then while I was in med school, I was exposed to plastic surgery, and I saw how neat and wonderful that was and what a difference you can make for people. And so I said, that's what I want to do. So after I did a full general surgery training, 5 years of general surgery, and then I did a full 3-year plastic surgery fellowship after that, and loved it ever since. So
great.
Yeah.
So where would you be in life if medicine hadn't found you?
That's a great question. Yeah, the veterinary medicine could be something that I would do, like most of my plastic surgery colleagues, very artistic. I don't know if that would be something that would pay the bills, but I enjoy working with my hands and doing all those sorts of things. So,
okay, something with your hands, something active.
Yeah, something active, absolutely, yes.
Great. So is there a procedure that patients come in constantly asking for? What's the most popular procedure at your practice?
I would say probably between, they're all like your children. You love each procedure that you do. But I would say eyelids is one of the most common ones that people ask me for. And so just, when people see you, they see your eyelids. And so when you have that sense that you're looking tired or you're having trouble seeing or something, rejuvenating the brows and the eyelids is really helpful for that. And of course, right up in there is, the mommy makeover stuff, breast augmentation, lift, liposuction, and tummy tuck. And those can make such a big difference on people's lives.
So is there a procedure you enjoy doing the most?
Yeah, probably between one of those two. So it's kind of a good fit that, you get those and take care of those a lot. And I think the idea, at least for most of us, and me personally, is when I get to help someone and make a difference for their lives where both they look better and they can interact with life better. I mean, that's very rewarding. I had someone tell me last week, you've changed my life. And that's a good feeling to have.
Definitely. I mean, going off of that, is there a story you can share that has really made you step back and think, this is why I do what I do?
You know, I think it's, a patient comes to mind who is a young mother of some children, and I can't get into all the details, but she had some tragedy in her life. And when she would see herself, see her body in the mirror and whatever, that she would physically be sad and depressed on thinking about that. And so after we were able to do surgery to get her back to wellness in terms of kind of the whole mommy makeover, breast and tummy, she was able to go through life confidently again. I mean, she was a pretty lady to start with, both before and after surgery, but the idea that she switched from being someone who is kind of sad and melancholy about life to just being confident and going about her every day, that's very rewarding.
Oh, that's amazing. Thank you for sharing that.
Absolutely.
So what are some of the biggest challenges you run into as a doctor, as someone who's in charge of the logistics and business side of things? Is there anything that you've run into that you're like you were not prepared for?
Yeah, I think some of the biggest challenges, at least for me in my practice, is that medicine is constantly changing, or the amount of practice changes that I've had since I've been at the group that I'm at, which has been very stable. So I'm thankful for that. A lot of my friends have had 2, 3, 4 job changes since they finished their training, a decade ago. But you'll have changes in insurance companies. You'll have one hospital bought by another. You'll have a group who send you patients for a particular problem, and then they're supposed to send them somewhere else. Those kinds of things. So the having to navigate the ever-changing landscape of healthcare, I think that's a big challenge. And you have to be, especially as a plastic surgeon, you're at the end of, you're a subspecialist. You're taking care of problems that no one else wants to deal with, or don't have the skills to deal with. So being prepared to make those changes is pretty big.
Yeah, I mean, so what do you do in those instances? Let's say when a patient gets sent to you that's supposed to be sent somewhere else. Does your staff deal with it? Do you deal with that directly?
No, that's a great question. It's more of the opposite problem, I would say. When we see a patient, we just take care of them. My mentors taught me that you take care of the patient. So that's our priority, is taking care of the patient. But a lot of times there will be a particular problem you're used to helping people with, or a group of doctors with, and say, in my case, say there's some changes at university level or other things like that. They can divert those patients elsewhere, and so then sometimes that can leave a void in your practice or things like that, and so you lean into something else that you do. So avoiding burning bridges, getting along with people well, and interacting in a way where people know that you're there for your friends and neighbors in the community, and people beyond who travel to see you. I have people come to see me for hundreds of miles for plastic surgery, and that's fun because you know that you have taken care of someone that they trust enough that they're now going to trust you with their care as well.
Yeah, I mean, do you feel like you get a lot of customers that way through referrals and different people like that?
Absolutely, and that's our most important. Obviously, we love marketing, and we wanted patients near and far to know about what we do so we can help them in the best way that we can. But the best possible marketing that we can have is a word of mouth referral. A friend, a family member who says, you need to go see Dr. Steffen for your problem, and we're always very thankful for that.
Happy patients are the best.
Absolutely.
Great. So, with that, obviously, it takes an entire staff to run a practice. You have so many other people that might not even interact with the patient directly. Is there a common frustration among your staff that you wish you could just wave a magic wand and fix?
Of course, there's difficult patients. You can't wave a wand over that. Every practice has patients that can be difficult.
Right.
And of course, then there's the practice dynamics as well. Things have changed for them too. There's inflation. They have concerns at home that they have to deal with that are a priority. But what we've tried to set up in our practice is some simple rules for who can be a part of it, because we don't just take anybody to work at our group. We want people who work hard. We want people who are nice. We insist on that, and people who are going to be there when we need them to be there for work. And by having that culture established in the office, it makes such a huge difference for how we're able to interact with our patients. One of my number one complaints that I hear about our office is that they hear our nurses laughing about stuff when things are going on. I'm like, you know what? I'm not going to apologize for that. They're having a good day. They're working hard. They're doing what they're supposed to do. And so, those are just a few of the challenges, but I think by having that positive culture, I think that makes the difference, because everybody knows where we stand, and we hold the doctors to the same standard that we do for the nursing staff and the receptionists.
Oh, for sure. And I mean, having a positive work environment, a good culture, it makes it a happy place where people want to go to.
Absolutely.
And I think it just speaks volumes to have the doctor back up the nurses and make sure that they're having a good day, back up the office administrators and everybody on staff. You're all on the same team. Everyone's working together.
That's exactly right. It's a team approach.
Yeah. So is there a misconception that you feel like patients come in about plastic surgery and, they might come in with a certain idea and you have to sit them down and kind of explain things a little bit?
I heard a lecture from Dr. Song out of San Diego years ago that was wonderful, and he may still be in practice now, but he gave a lecture at that time, and he said that patients want their surgery to be free,
Okay.
They want their surgery to have no scars, and they want it to be perfect. And of course, we try to keep the cost as low as we can, but plastic surgery is expensive.
Yeah.
And we want there to be no incisions, but sometimes to take care of the patient and to fix their problem, sometimes there's going to be incisions that we need to do that. Not always, but a lot of times there will be. And then for the results to be perfect, yes, that is our goal. That is, Dr. Hammond says that. He tries to hit a home run every time. I'm of the same philosophy. That's what we want. We're shooting for a home run every time. Can we truly achieve perfection? No. A lot of times I'll see something that doesn't even bother the patient, that they want to be better. But we're always working. My number one goal, I look at myself as like a contracted artist. My goal is to help keep my patient happy, and if they're happy, then I'm happy.
So do you feel like patients normally come in having done their own research, or do they come in not knowing anything?
It's a mix. In our area, I think we have doctors in general have a pretty good rapport with patients. So that's a lot of trust, and I really appreciate that my patients put a lot of trust in me. I certainly will have people who will use Dr. Google to help inform them. If they're doing that sort of thing and want to do homework on their own, or people who are watching or listening, I would certainly encourage them to go to like something reliable, like the American Society of Plastic Surgeons website, where you're going to get a little realistic take on what plastic surgery is like, what to expect, watch some 3D animations, hear some patient testimonials. We saw a fun lecture today or yesterday at the conference where one of the presenters says, "Hey, what did I do to this patient?" And his answer was, "I put some makeup on her," right? So people could have come up with 10 different answers about how he had helped her, but he says, beware the social media posts and don't let that necessarily be your guide for how you're doing. Plastic surgeons, we have standards for how we take pictures for people, and we certainly it's important to follow those.
Yeah, I guess going off of that, you mentioned social media, different trends, people doing their own research. People might find information from not a reliable source, from different sites that might not be backed by science, and they might listen to influencers. Are there certain trends that you've seen on social media or in the industry that kind of worries you?
Absolutely. I think medical tourism is a popular concern among plastic surgeons, that people will travel internationally or to places maybe less reputable to have their surgery to save some money. And I would say saving money is great. I'm all about saving money. I encourage my patients to save money, but also don't put your health at risk to do that. And so I'd encourage anyone who's wanting to have plastic surgery, save, do whatever you need to, but have it done by a board-certified plastic surgeon. That's what I would recommend.
Yeah, do you have any stories you could share of people who have gone overseas and where it's gone wrong?
Well, I see patients somewhat regularly who will come to see me for follow-up, and they'll have one problem or another, skin problem, wound healing problem, infection or something, and they're hoping for me to help them, and I'm happy to do that, to help them with their difficulty. But to some extent, some problems are hard to fix after people have a difficulty, so I wish they'd just come see me first and we'd do it right the first time,
Right. Do you feel comfortable then going in and operating on someone who had just had another procedure that went wrong?
That's a discussion. That's a patient that depends on what they had done, what their problem is. And so while I probably feel comfortable helping fix them, there's going to be a long discussion. What are the pros and cons of what are we doing? What do we have to redo here? What are the risks of that? And the hallmark of a good surgical discussion with someone is we're going to talk about risks. We're going to talk about benefits. We're going to talk about alternatives. That's informed consent. And that's the higher standard that you can expect from talking to a board-certified plastic surgeon.
Definitely, yeah. Well then, where do you get that information? Where do you find out if somebody is board-certified?
Yeah, so that's you can look it up on the American Board of Plastic Surgery website or the American Society of Plastic Surgeons, and a lot of times the people will share that on their website. There's all kinds of people who can claim to be plastic surgeons. Some of that's unethical, some of it's illegal, but for the most part, if someone says they're a plastic surgeon, board-certified plastic surgeon by the American Board of Plastic Surgery, or they denote that on some line, that's probably going to be true. But the ABPS, the American Board, and the American Society of Plastic Surgeons would be great places to kind of confirm that. And the more they're affiliated with a trusted healthcare system or something like that, would be more likely for that to be honest compared to something that, if it seems a little off, why not do a little investigation, find out for yourself?
Yeah. Is there a similar board certification process for other countries too?
There can be, and I don't have all the details on that, but we do have an International Society of Plastic and Reconstructive Surgeons. In fact, this whole conference, we're filled with international trainees and plastic surgeons and all of that, and that's certainly something that we welcome. So we don't think that plastic surgeons in the U.S. are the only qualified plastic surgeons. However, there are some different standards, and as an American, if you're traveling to another country, you don't know the lay of the land the same way that someone who is local would. And so that's the advantage of probably stay somewhat close to home.
Yeah. Definitely. Yeah. That's a great piece of advice. I hope people listen to this. So, speaking of advice, have you ever gotten a piece of advice from a peer that has reshaped how you practice medicine?
Well, I mentioned what Dr. Hammond has said many times in lectures that I've heard him talk about hitting a home run every time. I think that's great advice. That's our goal. Our highest goal is to try to achieve the ultimate in patient satisfaction and keep working until it's done. At another doctor, when I was doing my general surgery training, which was just a wonderful foundational surgical training to just give you that core to build on with plastic surgery, and I'm very thankful for that. But the advice that was often thrown around at that time was take care of the patient. Yeah. That's our top priority. Our first priority is the patient. It's not money, it's not fame, it's not any of those things. Our first priority is to our patient. So taking care of the patient, and that keeps everything in perspective and helps keep you safe as well. And I think patients appreciate that. In terms of other advice, I had a retiring, very respectable, wonderful practice surgeon that I kind of feel akin with, and his advice to me, he said, with the changing landscape of insurance and this and that, he said, if I'd known how things were going to go in my practice, I would have gone strictly cosmetic 15 years sooner than I did. And certainly my practice is moving that way as well, as I sympathize with what he shared on that. We want to help people in as many ways as possible, but certainly there's a lot more value than people even know going into plastic surgery on taking care of things that would be where you're dealing with those patients on that very personal level of helping them with a personal problem, surgeon to patient, rather than having, people in the middle of all that.
Oh yeah, for sure. There's a lot that goes on into it.
Right.
So not only are you the doctor, you're the one doing the surgeries, but you're also the one running the logistics and the business side of thing and the financials. You're the one making those business decisions for your staff and for the patients. So when it comes time to something like purchasing new equipment, how do you do research into figuring out what to get?
That's a great question. I think the advice that I've received and I try to follow myself is to be slow to pick something. Don't go buy an expensive device because it's new and shiny.
Can you tell us any creative client requests that you've received?
Absolutely. Yes and no, I guess, is the short answer. I know there are plastic surgeons, many of my colleagues getting requests for things like horns or other interesting body modifications. In Missouri, we don't get a lot of those sorts of requests, but plastic surgery is a specialty where creativity is allowed, and so that's kind of nice. So, just one that comes to mind from just a week or two ago is I usually do my breast augmentations through a submuscular incision, but this gal insisted on having it axillary, so we did an endoscopic axillary breast augmentation. We just followed the same principles that we use for our usual submuscular, and the surgery went great. The patient had a nice recovery and a beautiful result. And so I guess as far as interesting requests, people always will have some way where they have decided that the way that you normally do something is best. But if I could give some advice to patients, as a general rule, you should probably do it the way that your plastic surgeon recommends to do it, because there's probably good reasons why they recommend doing it that way, and also they're likely more comfortable that way as well. But anyway, that was a fun example of a case that went really well, and the patient had a great result, even though, like I said, she probably, there's pros and cons to each approach to each surgery.
Yeah. So kind of with that, if you've had people request something different, or have you ever had a client confrontation go wrong? And how do you handle that? Yeah,
that's a great question. I think that the vast majority of my patient consultations and interactions are overwhelmingly positive, and I'm very thankful for that. But yes, from time to time there is conflict, and that's because surgery is a big deal. People's hearts are in it. Sometimes there's cancer involved, or family factors, or finances. There's any number of issues, and I find that most of the time, if there's a conflict, some of those other factors are at work as well. So on my personal goal, I try to let patients know that I'm not solely responsible or able to make them happy if they're unhappy for one reason or another. But my goal certainly is for them to be. And at the end of the day, in any confrontation, I want that to be resolved in a way that is good. But if it can't be, then my hope is that I have behaved in such a way and been kind enough, gracious enough, patient and humble enough that I don't have anything to be sorry about at the end of the day. So that's my hope. I'm sure I haven't been perfect at that over the years, but that's the goal that we're shooting for.
Of course. Who isn't?
Right.
So, through all of your years of experience and everything that you've done, if you could go back in time and sit down with your fresh out of med school self, what advice would you say?
I think a lot of the path would be the same. So I think I'd say, stick with it, and it's a long road, but it's a very rewarding one. And so I think most every step I would do the same. I think that I would have embraced the aesthetic part of plastic surgery even sooner in my career, just because it's so rewarding for the patient and makes them happy, makes me happy. So I think if I were to give some advice, that would be some of it. But for the most part, it's been a fabulous journey. Very thankful for it, and it's just been really rewarding. And I never have to be sad about going to work because I love what I do.
That's amazing. We love to hear it.
Yeah.
Well, thank you so much for your time. I appreciate it. And this has been the Nitro Channel.
Thank you.
Thanks.